Making every rupee count for health. Financial management reforms in Andhra Pradesh. Within the health department, the responsibility of entire management, including financial management, lies mostly with the doctors as managers of the public health system. A major portion of the money flows out of the treasury system through societies in the form of bank accounts, for which rules and procedures are defined by the Ministry of Health, Government of India's disease control programs and state government financial systems. Inadequate and inappropriate management of these accounts and financial systems results in poor implementation of the health programs and provision of services. Similarly, in Andhra Pradesh, poor financing and financial management systems within the health sector prior to the reform process had the following repercussions. The financial burden of disease and illness was large and distributed unevenly. The poor, the scheduled caste and scheduled tribes experienced worse health outcomes. Budget on health, medical and family welfare as a proportion of total public expenditure (TPE) was very low at 3%. Budget on health, medical and family welfare as a proportion of gross state domestic product (GSDP) was less than 1%. Capital outlay on HM and FW as a proportion of TPE was also low at 2 to 5%. Incremental approach was adopted in annual budget formulations. There was no connection between budget, policies and goals. Too many budgetary subheads resulted in lack of clarity in incurring expenditure. Medical professionals occupying key posts had neither experience nor training in finance and managerial matters. Weak internal audit system. No uniform set of FM guidelines matching the international standards INTO SAI for monitoring of accounts. No financial MIS tool for recording budget estimates, allotments, budget release orders, treasury authorizations and expenditure outturn. These findings were articulated in many diagnostic studies like the fiduciary risk assessment which preceded the Andhra Pradesh Health Sector Reforms Program. The government of Andhra Pradesh led a major health sector reform program funded by Department for International Development DFID and technically assisted by FHI. Finance management reforms were identified as one of the key 4 areas of reforms. It was imperative to improve efficiency in allocations, expenditure management and focus on value for the money spent in terms of better outputs for the envisaged health outcomes. The department established a Financial Management Unit (FMU) and appointed a professional financial advisor to lead the financial management reform process. The FHI-led technical assistance TA team coordinated the financial management activities with the FMU and ensured involvement of all potential stakeholders from the sub-departments and the finance department to set up a FM reform team involving the government and FHI in order to work on the recommendations. This team compiled the recommendations from more than 10 preparatory studies. A prioritization process took place through which the Principal Secretary identified the immediate need to strengthen the FM within APVVP, an autonomous organization responsible for secondary healthcare within the department, and requested the reform team to suggest steps for improvement. The The reform team, in coordination with the team from APVVP, conducted a sample study in 2 districts and suggested HR and procedural corrections within the FM systems. Fiduciary risk assessment recommendations, critical key reports considered by DFID for funding the program were the basis for all financial management reforms. TA ensured that the department implements the recommendations within the FRA. The major reforms were as follows. The presence of drawing and disbursing officers, DDOs, responsible for managing finances of the health facility or administrative office in every PHC. A medical officer led to higher fiduciary risks through non-compliance of financial protocols. A process was initiated to assess the feasibility of rationalizing the DDOs at the state, district and sub-district level and ensure that DDOs' responsibilities were entrusted at a higher level where major activities occurred. The assessment recommended reduction of the DDOs and reorganization of their structures and functions. The department was expected to centralize DDOs' functions to the level of the newly formed community health and nutrition clusters at the sub-district level based on TA recommendations. The reform team reviewed the functioning of the societies in 3 sample districts and suggested a compliance model to strengthen the financial and reporting functions of these societies in the context of integration with the NRHM. Medium-term expenditure framework is a process of preparing a 3 to 5 year budget projections based on the previous expenditure patterns and the future plans in terms of the budgetary heads, keeping the overall resource envelope in mind. APHSRP provided a platform to the health department within Andhra Pradesh to be the only department to have prepared MTEF for departmental planning process. In order to internalize the process based on the reform's recommendations, a 5-day training program for 22 planning and finance officers from the sub-departments was conducted in January 2010. More than 6,000 officers and staff from across all the sub-departments have been trained in office administration and financial management. Key FM reforms included recognizing FMIS as one of the 6 elaborate modules in the HMIS, development of KPIs for the DDOs and the institutions. Internal audit was given a major thrust by constituting Bureau of Internal Audit System, a centralized cell functioning at the finance department level. This cell has the mandate to conduct extensive IA for all the departments under the government of Andhra Pradesh. The department initiated regular monitoring of the expenditure by classifying the budget heads into A, B and C categories, prioritizing the importance at the government and at the HOD level. The department accelerated FM reforms by reducing the redundant subheads within the annual budgeting process. Budgetary allocations were increased. Streamlined monitoring ensured improved utilization and progressive steps towards achieving program goals were made. Efforts were also made to involve the Ministry of Health and Family Welfare, Government of India, to focus on health financing and scaling up social protection for the underserved population. This was done by organizing a national-level health financing seminar with participation from the academia, donors, subject specialists, health department of state governments and other departments of the national government. Most of the FM reforms are currently being rolled in a prioritized manner. The implementation of these major reform recommendations is going to result in strengthening financial management protocols and overall systems that will contribute to a public health system that is not just dynamic but also responsive in addressing the basic public health needs of the people of Andhra Pradesh, especially the poorest of the poor.